So now we're going to move into the neck. So we are going to be doing procedure number 27, the suboccipitals. If you have a chair, grab a chair. It's lovely to grab a chair. If you don't have a chair, you can always just kind of assume like a warrior stance and tie a pseudo bow stance down on the knees to make it more comfortable for you. But if you have a chair, it just makes life a little easier. But I don't always have a chair, so options are available. So suboccipitals, number 27. With one hand, stroke laterally from the midpoint of the occipital ridge out towards the mastoid process. So I'm going to move myself up to the occipital ridge, and with one hand, I'm just going to stroke out laterally until I hit that mastoid process. You can always make compressions in small circles. The easiest way for me to sometimes get under, if there's not a lot of space here underneath the neck, is I'll come in with my thumbs and I'll wrap my hands around like so, and then I'll pull back. So sometimes there's not a lot of space here, so put your thumbs in, roll around, and then come back, and then just let your hands rest on the table, and then bring your fingers up, and you're right in that occipital ridge. If you had me for cert class, I always say it's like Barbie or Ken with their head on too tight. We gotta get up into this space and just make some space between their C1 cervical vertebrae and their skull. So I'm just making small circles at first. You can see my body's moving. I'm still using, even though I'm sitting, I'm still using my body to help with the pressure. My fingers are relaxed. I don't have stiff fingers. That's going to, if I had stiff fingers, it's going to make my hands sore. They're just relaxed, and I'm letting the weight of his head make my pressure. So you want to make sure that they're giving you dead weight. Sometimes people might kind of hold their head up, and you can just kind of give them a little bit of a bounce and be like, it's okay, go ahead and just relax. Relax your head into my fingers. So I'm just warming it up, making small little compressions and small little circles, and then I can come back to the starting point, and I can just stroke out. My hands are just resting on the table, my fingers are up, and I'm just stroking out laterally to the left, nice and slow. And now I feel like the wave that we'd feel going down the back, I feel it on the side of my finger. And as we reach the mastoid process, sometimes it gets a little bit more sensitive because the fascia gets a little bit more thick around that big bony landmark attachment. So you can maybe slow down and make small little circles there. And then I would just go back to the midline, the center of the occipital ridge, and I would do the same thing, and I can continue out on side 2. And don't be afraid, like for example, when I'm making small little circles, when I lean back, I'm kind of trying to pull into his head a little bit to make a little bit more space and open up that fascia a little bit more before I do my stroke. So use your body. Now I'm using both fingers to make circles, and I can see the movement of his chin. Then I know we're really kind of using the motion of him to also loosen that fascia. So little things to do there. Now we're going to go into the cervical intervertebrals. So we're going to stroke the cervical intervertebrals between the spinous and the transverse process. So I can't feel the spinous process quite as well, but I can feel the transverse process right down the center. So we can do this a few ways. I'll start with the way that we'd probably do the easiest, that we kind of know from circ. In circ, we slip our hands under, and then we lift up and we slide back. We're going to do the same thing, but we're going to be right along that laminar groove of the vertebrae. So get your hands under, feel the spinous process, and just roll off into that little groove along the side. So I'm right about T1, C7, and I'm just going to lift up, and then slowly just slide. I'm sliding up towards his head as I lean back. My hands are relaxed on the table. I'm using the table to help me with pressure. Oh, and we found a little spot here, a little congestion, so I'm going to stop, and I just put my fingers up a little more, and I'm making small little circles right up along the spine, lateral to the spine, not on the spine. And then that takes me right into that occipital ridge. So I can do this stroke before I do my occipital ridge stroke. It's totally fine. Another thing we can also do, if the stroke is difficult to get, move yourself down again to about C7. C7 is that first vertebra that sticks out the furthest at the base of the neck. I can just lift up each vertebrae. So I'm just going to scoop my hands under and lift up and give a little bit of stretch to the neck and loosen up that fascia. So there's one, and I can hold that for a little bit amount of time. Come down, lift up again. This usually feels pretty lovely. Anybody who's on the computer for any amount of time, like you are now watching me, this is great to do. And I'm using my body. I'm just sitting back as I bring my fingers down, and I'm using the table and sitting forward as I lift my fingers up, still in that cervical laminar groove right along the spine. And I can do this either before or after the stroke. If the stroke is difficult, each time I lift up, I can make small circles. If the stroke is difficult, this might make the stroke easier. Another way to do the stroke is to cup underneath the head, lift it up slightly, and then use my thumb to stroke down the laminar groove. So, get your hands under. Make sure that they're giving you dead weight. I'm going to scoop my hand underneath. I'm feeling his spine here, but I'm just going to roll right off of his spine and then let him get used to my pressure, my thumb. His head is giving me the pressure. I don't have to push up with my thumb. I'm just allowing his head to come down onto my thumb to get the pressure. And then I like to scoot back in my chair slightly, and I'm just going to stroke down that laminar groove. And I can pull slightly with my hand up on his head to give a little stretch as I stroke down the cervical laminar groove muscles. And don't stop where the body's at. If you can go past the neck into like the body a little bit and go with a little compression, yum, lovely. You might get a little slurp from your client there. I just rolled off some tightness there, so I'm going to come back and do a little more of a compression in that one area. But my hands relax. I'm using the table as much as I can. If my hand was not on the table, that would be a lot of pressure on my hand. Let their head give you the pressure. Big, big, important point. And then I can pull up with my other hand on his base of his skull to give him a nice little stretch. So those are the intervertebrals of the cervical vertebrae. Now we're going to be moving on to the sternocleidomastoid. Sternocleidomastoid, a very important muscle that causes a lot of, I call this a very passive-aggressive muscle. It usually doesn't hurt here ever, but it sends its pain to all different areas of the body. So this is a muscle to get really comfortable with. We're going to start number 29 with the pincer compression of the sternocleidomastoid. We want to work the whole entire sternocleidomastoid. So we can do this either way. We can come across the body or we can be on the same side, and we want to reach back far enough to get the clavicular head of the sternocleidomastoid. So I'm using my fingers to get on this lateral side of the sternocleidomastoid. I'm going to kind of pull it up towards me, and then I'm going to use my thumbs to get the medial side and pinch it in between my fingers. And then I'm going to make small little circles as well as I'm kind of trying to pull it away, because underneath on this side is those anterior scalenes that we're going to get next. This isn't lovely. Just take your time, go slow, but it's very, very effective for many, many things, from headaches to ear trouble to dizziness to circulation. And then we're just going to move up. I usually kind of start in the middle because it's where I can get it the best. And we want to make sure we just get the whole thing. So you can go down and then up and then down. Just so you can get the whole thing. So I'm pushing down with my thumb, up, pinching with my fingers, and kind of trying to pull it away as I'm making small little circles. I'll take one hand away so you can kind of see what I'm doing. And I can feel in the back side, it's got a little adhesion, a little line of tension. And then take it all the way up. It feels better with two hands. It doesn't feel as pinchy. So I always like to kind of keep both hands on there. And as we get up towards the top, this is where it usually gets nice and tight near that sternocleidomastoid, or near the mastoid process, near the attachment site right up there. Oh, it's just, well, get it. Sorry. And then we'd work, come back to the middle, and we work all the way down. Another way to do it, let me get this lower part. Another way to do it is same side work. So sometimes, since I go to people's homes and I do out calls, sometimes where I set up, I don't have a lot of room, so I can either do this across the table, or if I have room on the same side, I can do the same side of the table. So now it's the same thing, but I'm going to be using my thumbs on the bottom, my fingers on the top, and I'm usually going to be lined up with the muscle, but I want to show you first to get a hold of the muscle here. So the same concept. And you can see what a good grip we have on that sternocleidomastoid with this technique. We just want to make sure we get all the way to the sternal end of the muscle. Sometimes this gets forgotten. It's a thicker muscle than we might think. And the same thing. And as I get to the top here, I can really get in near that mastoid process from the bottom as well as the top, and I can pull it away and really loosen it up. Underneath this is our carotid artery. And can't think of the name of the vein, it'll come to me in a minute, but those two blood vessels allow blood to go into the head and out of the head. And when these muscles are tight, this is what can cause a tension headache. So that's the beginning of the sternocleidomastoid, and now it's going to make it a little bit easier to stroke down the sternocleidomastoid. We know where it's at, we got it nice and loose. Sometimes in the beginning I like to kind of stand up on the sternocleidomastoid. I'm on the medial side of it, pushing it away. And then once I get my depth, I can kind of sit down. My other hand is supported underneath his skull. And I'm just going to slowly move down. I can switch or do finger work, whichever you prefer. Sometimes this refers pain up into the forehead. So for me, for example, when I get deep work on my sternocleidomastoid, the pressure isn't so much in the sternocleidomastoid that's uncomfortable, but it's pain in the forehead. So if they have referred pain anywhere that is too much pressure, lighten up on your work. And then we can go right down the center. Either using thumbs again or fingers, and sometimes I like to pull the head back a little bit to help me with the stroke. And I can bring my fingers around. And then I can do the lateral, the posterior side of the sternocleidomastoid. So I usually like to do, try to do 3 strokes of this muscle. And this is another sensitive area to people because not a lot of people are used to getting the front of their necks worked on. They can kind of consider that the throat. But it's the muscle that causes a lot of pain even in the back of the neck. So get comfortable and confident with the sternocleidomastoid. So last but not least, procedure 30 are scalenes. So scalenes, they go underneath, they come to the cervical vertebrae and they go underneath the clavicle and attach to the first 2 ribs, and we have anterior, lateral, and posterior scalenes. So part of the anterior scalenes begins right underneath sternocleidomastoid. So now that we've got that nice and loose, we can get underneath the sternocleidomastoid and stroke down the scalenes. Scalenes to the brachial plexus is kind of like the piriformis is to the sciatic nerve. When this scalenes muscle is tight, pressed in on this brachial plexus, it can cause all kinds of issues down into the arm. So a lot of the times when I'm working on somebody and they're having trouble in their hand, their wrist, their elbow, might not be the hand, the wrist, their elbow. It could be coming all the way up here from nerve compression on the scalenes muscle. So I stroke all the way down. Since it goes underneath the clavicle, I'll end the stroke with a bit of a compression to try to go under that clavicle towards that rib. And I'm thinking, if I'm thinking of a bone-to-bone intention of where I'm trying to create space, I'm trying to make space between the cervical vertebrae and the rib cage, opening him up this way, making his neck longer, if you will. I can use supported, or I can use fingers, or I can use a thumb, holding the head underneath with my other hand. And there's plenty of work in the scalenes. We can be here for so long. A lot of the times, Elijah's aren't very bad. A lot of people, they feel like guitar strings. They're very, very tight. So he's got a little adhesion here, so I'm going to stop and just make a small little circle in that area. A little melting of that fascia a little bit more specifically before I let it glide on down. A little bit more here. Pressure okay? Normally, I'm not talking this much in somebody's face when I'm working. And then continue the stroke on down. You can feel as it gets down to the bottom, it's very, very ropey. So I feel like I'm right on it and I want to kind of slide over to the side of the rope to finish my stroke. Now my hand's kind of in the way, so I'm going to bring my hand forward. I can also bring my other hand in there to finish my compression underneath the clavicle. You notice I try to keep their head with all of this work. I want to try to keep their head straight. I don't turn their head to do this work. The sternocleidomastoid, the suboccipitals, I like to try to keep their heads straight where those muscle fibers are running in their natural direction that they're supposed to be running. If I turn his head and I worked here, I'm stretching all these muscles, making them a little bit more taut. Is that the word? Taunt? A little more tighter, and they're not as pliable for me. So if anything, I might bring their head into my thumb a little bit to help me with pressure than I would if I was going to push it away. And we're just started near this, just inferior to this, or deep to the sternocleidomastoid, and we're just going to move back as posterior as comfortable. So now I'm working more on those lateral scalenes. Getting thicker down below. So I'm going to change from a stroke into small little circles. Scalenes is a really good muscle to really get a good feel of lines of tension and adhesions and muscles, because there's plenty. So if you're not even quite sure what that feels like yet, rhomboids is another one. You know, I can find what we call knots in rhomboids, and sometimes it's good to work on a muscle that's in trouble so we know what that feels like, and then we can find those trouble spots in other muscles that are not usually as prominent when it comes to finding adhesions. And then since I'm getting more posterior, I'm going to switch to fingers because my fingers just fit more nicely, and then I can kind of push up and again let his head and neck help me be the pressure, so I'm not having to push so much up and letting his head just kind of fall and his neck into my thumbs or into my fingers. And now we're working posterior scalenes, which comes down and attaches to the ribs on the back side. There's plenty of work to do in a scalenes. I can spend a good 20 minutes in my hour massage, easy, working scalenes if I really want to take my time. But this is also a muscle that I don't want to overwork because it's not used to a lot of specific attention. But who doesn't like neck work? And then I would just continue on the other side. And a lot of times when I'm doing neck work, even though I did I would usually do sternocleidomastoid and the scalenes at the same time on the same side before I went over to the other side, just because I got that sternocleidomastoid nice and loose so I can get into those anterior scalenes. So that's how I would finish it. And then I would just move myself over and continue my work on the other side. And then it's always good just to kind of make nice at the end. Make it still kind of massagey, whichever that looks like to you. And of course, with every session, no matter where you're at, it's really good to do some kind of a closing, just like we want to do an opening in our massage, to kind of just that close out your session. And there we go, all done.